All right, let me come here and do something with this. Um, how can I put it so we can view full screen? Okay, there we are. Hey guys, this is Dr. A. Rivera. I want to talk today about coronary artery disease and the link to foods and what it's called the allergic myocardial infarction. The reason I'm saying this is that I recently had two cases in which I spotted in the normal labs that this person was at high risk of a myocardial infarction. Actually, in both cases, one of the individuals died. The other guy was on his vacation when this actually happened. I treat a very how do I say this? My clientele is a clientele that's very aware of their health, but they're also very successful people. But in this case, these two individuals were not really into this yet. They just started. One of them did the labs and never came back. He never answered my emails, my text messages, my calls. And the other one, it was too late. And the changes have to be sometimes abrupt in order for us to save ourselves from these nefarious consequences. Here, what I have is a page of my book, Primal Fields, pending publication, and is the part that I talk about corn and the corn derived products. And there is a link between those and coronary artery disease. But if you see here, there's also a link with type 2 diabetes, hypertension, obesity. Obviously, there's because it promotes inflammation. All the diseases that are related to inflammation will also can be worsened by ingesting this type of a food like product. Hey, sometimes things that we think are healthy are not. So I wanna say this. Many times I do testing of things that appear not to be related just because there is a relationship. But now imagine someone, now that we know that coronary artery disease is an inflammatory illness. Imagine someone ingesting foods that appear to be healthy for others but are inflammatory for him. That means that his diet, his nutrition plan, can actually worsen or drive this individual towards a myocardial infarction. And in my practice, I see a lot of this with so-called dietary foods, foods that are labeled as gluten-free. People think that something is labeled as gluten-free, it's healthy, but remember that it's processed. And if it's processed, it's probably not good for everybody. Doesn't mean that everybody that consumes it's gonna be in trouble, but the guys that have the trouble, this thing will get worse. So let me show you something here. There is something called the Cuny syndrome, and this is basically what it's the allergic myocardial infarction. So this is the myocardial infarction that would happen when the person is ingesting that food that triggers this reaction. This reaction is many times mediated by mast cells or the granulation of these mast cells of all these mediators that will actually be part of the immune response. We have found that this type of inflammatory substances released by the mast cell are elevated in people with acute myocardial infarction. So imagine this: I'm ingesting something that triggers my mast cell to to cause an immune response, and I already have coronary artery disease. So there will be a swelling, there can be a dislodging of a thrombus in the artery. And understand, if I have coronary artery disease, the lumen of my arteries in the heart, it's small. So imagine a bit of swelling in the artery will just close the lumen a bit more, impair blood supply to the area of the myocardial muscle that is supplied by that artery, causing a deficit in oxygen delivery to those myocardial cells. And that, guys, is a myocardial infarction. You can read some more about unstable angina and an allergic myocardial infarction in the page of the American Heart Association in the Journal of Circulation. This is something that you can read here for free and for fun. And I wanted to also show you guys here the definition of the mast cell according to the National Cancer Institute, they highlighted something, but what I want you to see is this. Mast cells, they release chemicals during allergic reactions and certain immune responses. These chemicals may vary in many effects, including widening of the blood vessels and angiogenesis, right? But during the allergic response, they can cause flushing and itching. In large amounts, they can cause abdominal cramps, muscle pain, nausea, vomiting, diarrhea, low blood pressure, and shock. Mast cells are part of the body's immune system. Now, when you see here that it can widen the blood vessels, is when you get a trauma. This is the type of cell that will actually cause the vasodilation, and that's why the area looks red. But you don't want when it causes the swelling, because that swelling is not good. Now, and I mean swelling in the artery. But imagine this: you have the lumen in the artery is narrowed, and now you have also a low blood pressure episode. So I decrease the blood supply to that muscle. I narrow the lumen of the artery and now decrease blood pressure. So that means that a lot less um, blood and oxygen will get to the myocardial muscle, creating basically a perfect storm. These are some of the things that I work with my patients. We work this in our coaching program mostly. Try to help people overcome these things. Sometimes we're not preventing the disease because the disease is already there. What we want to do is to deal with the complications. We want to take this event and try to push it forward multiple years or see if it never happens. But if it does happen, our body is strong and ready to overcome. So that's all I have for now. I hope this sheds you some light on what we're talking about. So until next time, guys, you have a wonderful rest of your day.